I'm just waiting for the stroke of 7 o'clock to start. Oh, and there it is. All right, good evening, everyone. Thank you so much for joining us as we start the 2022 COVID-19 Vax Facts, the virtual town hall series sponsored by the Montgomery County Immunization Coalition and Montgomery County. In 2021, the MCIC and Montgomery County, in cooperation with numerous community partners, presented about 14 town halls to various audiences on vaccine topics. And we found this to be very, very successful in giving information to the public. So for 2022, we've decided to have a regular series, which tonight obviously is the first one. So I am your moderator for this series. I am Dr. Richard Lorraine. I'm the medical director of the Montgomery County Office of Public Health. I'll be joined tonight by Dr. Tasha Lee, who is the Associate Medical Director of the Norristown Regional Health Center, Dr. Stephen Shapiro, the Chairman of the Department of Pediatrics at Jefferson Abington Hospital, and Dr. Angela Nicholas, the Chief Medical Officer at Einstein Medical Center in Montgomery. The format for this evening will be that we will have an introduction from each of our panelists, and then we'll start with questions that have been previously submitted. And we'll take about 40 minutes or so to go through those questions. If we have time afterwards, about 10 minutes or so, we'll also be looking to take questions that come in this evening. And you will be able to enter those questions through the Q&A function. The chat is disabled during this presentation, so please use the Q&A function if you do have a question that you would like one of our panelists to answer. And also, if you want to direct it to a specific panelist, you can indicate that in your question. So I'll start with introductions. As I said before, I'm Dr. Richard Lorraine, the Medical Director of the Montgomery County Office of Public Health. I'm an internist, and I've practiced in Montgomery County for about 36 years now. In addition to these duties, I'm also commissioned in the Pennsylvania Air National Guard and command a medical detachment. And now I'll have each of our panelists introduce themselves, starting please with Dr. Lee.
Hi, good evening, everyone. My name is Dr. Lee, and I am the Associate Medical Director at Norristown Regional Health Center in Norristown. And I'm also a family nurse practitioner there. And before I became a nurse practitioner 5 years ago, I was a labor and delivery nurse and have over 20 years of experience as a labor and delivery nurse and as a certified lactation consultant.
So I was having a little problem hearing that. I don't know if that was just me, but
no, it was tough.
Okay, Dr. Lee, that was very, very faint. We weren't able to hear. Are you able to increase the volume on your microphone, or perhaps?
Absolutely, absolutely. Can you hear me a little bit better now?
That's much better.
Okay, great. Okay, so I'm the Associate Medical Director at Norristown Regional Health Center in Norristown. I'm also a family nurse practitioner there, taking care of patients of all ages. And prior to becoming a nurse practitioner 5 years ago, I was a labor and delivery nurse throughout the Philadelphia and Montgomery County region and a certified lactation specialist.
Excellent. Thank you so much. Dr. Shapiro.
Hello, good evening, ladies and gentlemen. Steve Shapiro. I'm a pediatrician in practice in East Norriton for over 40 years. I'm chairman of the Department of Pediatrics at Jefferson Abington, and it's a delight to be on this panel and participate with the Montgomery County Immunization Coalition. Thank you for inviting me, Rich.
Thank you, Dr. Shapiro. And Dr. Nicholas.
Hi, good evening, everybody. My name is Dr. Angie Nicholas. I'm the Chief Medical Officer at Einstein Medical Center, Montgomery, and a practicing family physician at North Wales Family Medicine, located in North Wales.
Okay, thank you very much from all of our panelists. And we will go right now to the questions that have been submitted ahead of time. And we'll start off with Dr. Lee. Dr. Lee, what can you say about the side effects for kids from the COVID-19 vaccine?
So side effects from the COVID-19 vaccine for children are usually pretty mild. The most common side effects that children experience is a sore arm or redness and swelling where they get their injection. But some children also might have a headache or be a little more tired than usual or have some body pain, which can be easily treated with over-the-counter medicines. Many of you, I'm sure, have heard about the myocarditis and the pericarditis that we see mostly in males, in teenagers, and young adults. So far, we have not seen myocarditis or pericarditis in the younger children between 5 and 11. But what that is a little inflammation around the heart or the lining of the heart. And even those cases, although rare, have been mild and easily treated.
All right, thank you very much, Dr. Lee. Dr. Shapiro, is the COVID-19 vaccine causing heart issues in kids? Well, we already had an answer to that question.
Dr. Lee answered it very, very well. Let me
I'm so
just
sorry.
add one little piece. I'm not going to repeat anything she said because you were spot on. But I did read a paper just pursuant to the question in the last day or two published in JAMA Pediatrics that really analyzed those children who had myocarditis, developed it, and were proven to have it. And the data was quite convincing that even those small numbers of children that were finding themselves with that finding had gotten back to absolutely normal left ventricular ejection fraction within a couple of weeks. So there's really nothing to worry about. Everything returns to normal. The key here, and the one other piece I'll mention is we now were able to study the effects of the vaccine on children if it were to cause a problem. Now, the correlate of that is if the virus causes the problem, then all bets are off, ladies and gentlemen, and we don't have that information. Time will tell us the information, but the information I shared with you just now is confirmatory and factual, but the information that I cannot give you regarding the vaccine, regarding the virus itself, is still up in the air.
Thank you. Dr. Nicholas, here's one that we've heard quite a bit about. Can the COVID-19 vaccine affect puberty or future fertility in children?
So a lot of parents have been really concerned about the COVID-19 vaccine and the effect, again, on puberty or their child's fertility long term. It's important that everybody understands that we've actually been doing a lot of studying about this because, again, parents have been very concerned about this, concern that started very early on with the vaccines, when the vaccines were released in adults, for example. What we have found is that there's no evidence that the COVID-19 vaccine will affect puberty or will affect future fertility in any children. Interestingly, I did find a couple of references, and I was unable to find the article today, but I'm going to try to find it tomorrow, that COVID infections actually can affect men and in their ability to maintain erections, which could potentially affect future fertility as they try to have children. But again, so really the vaccine, once again, we just talked about myocarditis and protecting yourself against myocarditis. This is another way, the vaccine potentially protects against future infertility problems. It does not cause fertility issues.
Thank you very much. So back to Dr. Lee, and this is a question that isn't directly related to vaccines, but is very, very much in the minds of people these days. Can you speak a little bit about monoclonal antibody treatment and specifically sotrovimab?
Okay, so the monoclonal antibodies is an injection, or it's a treatment to kind of reproduce what your body naturally does when you get an infection. The antibodies help fight off the infection, they help fight off the virus. So the monoclonal antibodies is a treatment that we can offer, one, for people who get infected with COVID, or two, for people who've been exposed to COVID and we want to prevent severe COVID illness. So we would generally give it to individuals who would be at risk for severe COVID illness or complications if they got COVID. It also helps prevent hospitalization and death. So initially, the monoclonal antibodies were only approved for under emergency authorization use for individuals 12 and over. And then we got emergency use authorization all the way down to newborn. However, what we're finding recently is that the monoclonal antibodies have not been as effective against the Omicron variant, which is what, the latest variant that we've been seeing. So it might not necessarily be an option. So you really have to take it on a case-by-case basis, especially for children. It's something that you want to consider based on your child's health status and the infection that they have, the type of variant. If you even know the type of variant, you may or may not even know that. So it's really a conversation to have with your healthcare provider at the time of infection or at the time that you've come into contact with someone who has COVID.
Thank you, Dr. Lee. I'm going to just amplify a couple of points that you made. First of all, there were basically three different types of the monoclonal antibodies. And we found recently that two of them, as Dr. Lee mentioned, don't seem to have really good effect against the Omicron variant. The one that still does is the sotrovimab, which was mentioned in the question. So recently, the FDA actually has recommended halting the use of the two of them that aren't having that much effect on Omicron, but sotrovimab is still being used and is still having a fair amount of effect. Supplies, of course, are somewhat limited, so it's being used very judiciously for those who are at highest risk. I would also emphasize that treatment with monoclonal antibodies is not something that a resident, a citizen would avail themselves of directly. This definitely needs to go through your healthcare provider. So if you are sick with COVID, or if you think it might be COVID, we definitely encourage you to be in touch with your primary care practitioner or your child's primary care practitioner, and then they can discuss what therapies might be available. Thank you. Dr. Shapiro, this is also a good question that's not directly related to vaccination, although somewhat indirectly, and it's been very much in the news recently. How do you determine the optimal length of quarantine?
You gave me such an easy question, Rich. Thank you so much. I'm going to divide. I've thought a lot about this question, ladies and gentlemen, because it really provides a lot of anxiety in the answering, as well as some controversy in how we handle it between the differences between children and adults. So let me take my pediatric hat first and say to you that the new guidance after a positive test varies a bit. You've heard the public information that says if you're positive and you're well, 5 days, you feel better, you go back to work and you can go to work with a mask on if you've not had symptoms. Now, what we're saying about children in this very same situation, child that tests positive but is asymptomatic. Ladies and gentlemen, I hate to say it, but 10 days is still recommended because children often are very late producers of COVID virus in their nasopharyngeal airways and in their throats. So in general, the pediatric community has retained the 10-day period of observation for your children. I know that presents a hardship, but that's best medical advice, and that's what our practice is recommending, and we want to keep it that way. Now, there's a few other things that you should know, and I'll break them down very quickly. The CDC guidelines have changed a little bit because we know Omicron tends, which is 99% of the isolates in America now, tends to be an early producer of virus on the mucous membranes and people, and in general, children included, tend to be infected from about 2 days before and then for maybe 3 days after the acute exposure. So I think that then begins to give you some idea of where the 5-day range comes in. You need to keep that in mind as long as you're asymptomatic. If you're symptomatic, all bets are off. Now, the third area that I think you should know is, what if you've had an exposure to somebody who is already positive for COVID and you're not sick at all? Well, there's two categories. And very simply, if you've been vaccinated, if you received 2 doses of Pfizer or Moderna and you've been boosted, if you've received a single dose of the J&J vaccine and you've been boosted with one of the messenger RNA, mRNA vaccine prototypes, or if you've had any other series of vaccinations, but that include a booster, you should stay home, you should wear a mask, you should see how you feel, and in 5 days, if you're well, then you can just go back to work and probably wear a mask for those next 5 days. But if you've received Moderna or Pfizer or J&J and you've not had a booster, then I hate to tell you this, but you're considered unvaccinated. And as such, I think you're probably in a position where you need to get tested 5 days after your exposure. If you developed any symptoms, you're going to need to probably stay home and get tested again. And the last area that I'll cover very briefly is, if you are, do you need to be tested to come out of isolation? And it's just not necessary to do that at any time, whether you're vaccinated or unvaccinated. If you are back to your daily routine and you have felt better and you're 10 days out, you're fine to go back, as long as you haven't had a fever or any other symptoms. The problem that I face in children is, very often there's a lag time to the schools and to the daycares as far as them requiring tests to return or notes to return. So we've sort of simplified it for our parents, and we'll give the kids a note if they meet the criteria that I kind of reviewed with you very briefly and very quickly. It's a tough topic, and check with your healthcare provider to get the exact information.
Thank you. Dr. Nicholas, how long do the antibodies last in your system after getting COVID-19 with all 3 shots? I think that means after getting all 3 COVID-19 vaccines. Are you protected from the virus?
So this is a really interesting topic. You are protected from the virus after you receive your 3 vaccines. And the studies are showing that the immunity lasts about 6 months or so. The virus is mutating. And so the more changes that the virus has, the less immunity you have. But what we do know is that, and what we've seen, especially in the community, is that being fully vaccinated with your 2 shots plus your booster helps prevent you from becoming seriously ill. And I think that's the really important thing. You may get the illness, you may get COVID, just like when you get the flu shot. You might get the flu shot, but the illness that you get is significantly less than what you would get if you had not been vaccinated. And that's been proven over and over again. So lasts about 6 months or so, give or take, depending on what the mutation of the virus is. But the vaccine itself helps prevent you from getting very seriously ill.
Thank you, Dr. Nicholas. And I'll add to that although the antibody level as a result of vaccination or even from natural immunity is certainly important in helping to protect either from reinfection or serious illness, there's also other parts of the immune system that are involved. There's particularly parts called the memory B and T cells, which these vaccines can activate. And that's something that is going to be very, very helpful for long-term immunity. Dr. Lee, I think we've kind of touched on this as well. Who should get a booster shot?
So right now, a booster shot is recommended for anyone that is 12 and over. And so if you are between the ages of 12 and 18 and you received Pfizer, you can get your booster shot 5 months after you had your second dose. If you are over 18 and you've had Moderna or Pfizer, you can get your booster shot 5 months after your second dose. If you've had Johnson & Johnson, you can get your booster with any of the vaccines. I might mention you can mix and match the brands. So if you had Johnson & Johnson, you can get your booster 2 months after you've had your initial. At the current moment, there is no booster recommended for children between the ages of 5 and 11.
Very well, thank you. Dr. Shapiro, what will be the next developments in the COVID-19 vaccine? It's a very important topic.
Yeah, thank you. And Dr. Lee and I are working a tag team here because she starts it and I'm able to just add some additional clarity to it. So the next developments are very, very critical as to how we finish off the population. You have 38 million children that fit into the 2 to 11 class that are in the process of being vaccinated. At this point, only probably 25% of them, or maybe even a little more, have been vaccinated. But the key elements here are, number one, the 2 to 5 year old range vaccines are still being evaluated. The dosage that has been written and utilized in the 3 test groups seems not to provide as much seroconversion and antibody production as it did when it's compared to the adult levels. So part one is to get the 2 to 5 year old dosage correctly. I think that's probably going to be done by maybe the end of March, beginning of spring, but I think we will have it sometime in the not too distant future. The second thing Dr. Lee mentioned, we really have not come out with a clear recommendation on boosters for the 5 to 11 year old age ranges. And that has a lot to do still with the issue of first getting them treated, getting them vaccinated. We haven't come into that zone yet because that vaccine is only about 6 or 8 weeks in experience out there. I think there's going to be some question as to whether or not a booster is really necessary for that population, ladies and gentlemen, because I believe that the data is not as clear on the Omicron situation for that age range. The 12 and aboves basically are being treated like adults in the sense that after a 6-month interval from the first 2 dosage of vaccine, the recommendation is now for a booster. I should just digress for a minute for the 5 to 11s. It may be that the recommendation will come out as a 3-dose series for that age range, period. So you just get dose 1 at time 0, dose 2 at a certain period after, and a dose 3 at some period after that. So they want to study the time range for that. The last thing I'll say is, and you may have read some of this in the lay press, there is some work being done by Pfizer and by Moderna to create a Omicron specific vaccine that hopefully will add to our armamentarium and in high-risk patients be a very good adjunct to continuous care. There's a lot of up in the air stuff right now as to what this process will look like, given that what our goal is to kind of learn to live with COVID-19 and not necessarily try to vaccinate our ways out of it. It does not seem that with any of our very excellent strategies, we're going to get to a place where COVID-19, like say smallpox or measles, for that example, really becomes a minimal effect on us in society. I think we're going to have to think about it differently.
Thank you. Dr. Nicholas, again, I think you touched on this a little bit before.
Mm-hmm.
Can vaccinated people get infected with the Omicron variant?
So again, yes, vaccinated people can be infected with the Omicron variant. But what we're finding is that the illness that you do have is significantly less virulent than if you were not infected. So what people are, as we've talked about before, what people are generally seeing are symptoms very similar to an upper respiratory illness. I had a very good friend just yesterday text me and say that he was COVID positive and he would have sworn he had a sinus infection. So pretty similar to the upper respiratory infections that people typically have this time of the year.
Yeah. So I'm going to just take off from the statement that you just made, because I hear this one over and over and over again. Sinus infection. So there's so many people that I've been hearing say, I think I just had a sinus infection, and it turns out to be COVID. Well, please understand, those are the symptoms of COVID. So our recommendation, if you think you have a sinus infection, certainly consult with your primary care practitioner. But remember that these are symptoms that are easily consistent with COVID-19. Thank you, Dr. Nicholas. So I guess we're going to reverse the tag team approach here. And Dr. Lee, will we need Omicron-specific vaccines? And if so, how long will it take to get one? And Dr. Shapiro had teed that up for you.
I think he answered that well. So I'll just kind of repeat what he said and summarize. The manufacturers are studying Omicron-specific vaccines. However, right now, our typical vaccines are available. They are effective if you're fully vaccinated. To what extent we'll need the Omicron-specific vaccines and what those recommendations will be are yet to be seen. So I'll be waiting with the rest of you to find out the complete answer to that.
Thank you. Dr. Shapiro, I remember this question from previous town halls. Right. Can I get a COVID-19 vaccine or booster shot and a flu shot at the same time?
This is a great question, Rich. The simple answer is yes, absolutely. But it's a great question, ladies and gentlemen, just to understand how science has provided us with so much more information than was previously known. By example, and I'll just stick to this, last February and March, Dr. Nicholas and I were living in a world where we were giving vaccine out, and we did not know anything more about it. So we said very clearly, you give the COVID vaccine and everything else stays away. I got such a tongue lashing from a mom who when I saw her teenage daughter just in the spring of last year, and it's a good story, so I'll share it. She was so upset with me because I gave the child her correct dosage of vaccine for a 17-year-old, but mom had arranged to get the COVID vaccine within a couple of days of that. And she was furious with me because I messed that schedule up, and she wanted her child to have the COVID vaccine in time for the prom. I apologized to her. She was quite correct. I didn't know, we didn't communicate very well, but be that as it may, fast forward a few more months and us learning about the science of the COVID vaccine, it became very clear that it didn't matter when you gave this vaccine. There was a clear and complete immunologic response with COVID, regardless of what else you gave it with, the COVID vaccine with, regardless of what else you gave it with. So that's a long answer to say yes, and probably going forward, there's going to be studies to combine COVID vaccine with the flu vaccine once we get out of the time frame where we have a little more control of the situation. And I think it will probably end up, COVID vaccine will end up being a combination vaccine available to the population. So that's a long answer, but please don't worry, ladies and gentlemen, get your kids immunized with the vaccine with whatever time schedule works for you and your family.
Thank you, Dr. Shapiro. And I think he raises an excellent point that the science is evolving. And this is a very, very good example of how our advice has changed as we've learned more and more. So when questions like this come up, you hear me say this over and over, please consult with your healthcare practitioner. They are the ones who are following this closely, and they are the ones that hopefully you trust and they can advise you. Dr. Nicholas, here's a really, really important question. Are the COVID-19 vaccines safe for pregnant people or people thinking of becoming pregnant?
So the good news is that obviously time has progressed, and in the beginning there was a lot of concern from women who were pregnant or thinking about getting pregnant and whether they should get the vaccine or not. There has been a couple of studies, the most recent one, about 2,500 pregnant women who received the mRNA COVID-19 vaccine, so either the Pfizer or Moderna vaccine, before 20 weeks of pregnancy, and there was not an increased risk of miscarriage associated with that vaccine. The miscarriage rate was very similar to the miscarriage rate of the general public. There were other studies that were done that did not find any concerns for pregnant women that were vaccinated late in pregnancy or for their babies. And in fact, the risk of getting COVID during that time when you are getting ready for delivery or at delivery time, and the risk of that happening actually makes the vaccine very attractive for those, and just staying on your regular schedule for getting the vaccine is really very appropriate at this point. We've seen a very high number of pregnant women have COVID during their pregnancies and delivery. Obviously, we're concerned about that happening, and we want to make sure that everybody's protected. So please consult with your healthcare provider. But yes, the general consensus is that you should receive the vaccine when you're pregnant or thinking about getting pregnant.
And I'll touch on a related issue there too. There's been some concerns raised about possible impairment of fertility due to the vaccine. And we can say with complete confidence that not only is there no scientific basis for that concern, but the data has shown very, very clearly that there is no impairment of fertility from these vaccines. And something else we've kind of touched on already, Dr. Lee, does fully vaccinated mean 2 shots or 3 now?
Fully vaccinated depends on which vaccine you receive. So if you receive Johnson & Johnson, 2 vaccines would be fully vaccinated, your initial vaccine plus your booster. But if you receive Pfizer or Moderna, then fully vaccinated would mean 3 vaccines, your initial 2 plus your booster. So once again, not to beat a dead horse because we keep saying it, but just keep in touch with your healthcare provider who can keep you up to date on the latest recommendations, how many vaccines you need, and when they are due, so that you can anticipate and you can plan for your boosters and be fully vaccinated, because being fully vaccinated is what matters most now. If you're due for a booster and you have not had it, you are definitely at a higher risk of getting a COVID infection. So make sure if you're due for a booster, you know when you're supposed to get that and you can make your appointment.
Thank you. And along those lines, Dr. Shapiro, is it time to get another booster shot? And who should get a 4th dose of vaccine?
So as much as I knew about giving vaccines concomitantly with the COVID vaccine, that's how little I can offer to the audience tonight, Rich. There's been no recommendation that suggests a 4th dose at this point, ladies and gentlemen. I know lots of us, probably the panelists who received vaccine early on when the vaccine was first available, have come and almost are to the 6-month marker after their booster doses. I know I'm approaching that time, and I just don't have an answer for you. So Stay tuned is what I'll say. Just listen carefully. I'm sure the science will prevail. CDC is a fact-driven organization. They are looking at the data. What they see, they will respond to, and we'll certainly support it.
Thank you, Dr. Shapiro. Dr. Nicholas, so we're trying to either prevent or ameliorate these diseases, particularly COVID, and we mentioned flu before, by vaccination. Can someone get flu and coronavirus at the same time? And if so, what does that do to your body?
Well, we suspect that you can get both flu and COVID-19 at the same time. We don't really seem to be that worried about it. Again, majority of people that get influenza or the flu do just fine. Majority of people who have COVID do the same, especially if they're vaccinated. And you can get two different illnesses at the same time, two different viruses at the same time anyway. So we haven't seen a lot of it. There's been a few cases reported these are the kinds of things you see in the news, frankly, before you see in the medical literature. But what we do know is that, your body can create antibodies for two illnesses at the same time. So we would expect that if you got, if you had the rare incidence of getting both viruses, that you would make antibodies for both and be able to protect yourself from that moving on. So I think it's to be determined. If you recall last year, we had a very, very, very low incidence of influenza across the United States and really across the world. So I think this year, the numbers are still very low. We've had very few incidences of influenza again this year. I think we're seeing obviously more COVID than we are flu, but yes, you probably can get both. And most people, again, will probably do well, especially if you've received both vaccines.
Yes, unfortunately, I do have to note that just today we reported in Montgomery County 2 cases of people who had flu and corona who succumbed to that. So we had 2 deaths that were reported just today. So it certainly can happen, and the combination can be pretty bad. Vaccination can try to keep these infections from being so severe and certainly can decrease the number of deaths. And now we're going to have one final question that will solicit an answer from each of our panelists on. So what would you say to someone who is hesitant about getting the vaccine, or someone who is hesitant about their child getting the vaccine? And we'll start with Dr. Lee.
So we recommend the vaccines. We have been vaccinating now well over a year. And we have vaccinated hundreds of millions of people just in this country alone, not even, including the rest of the world. So we know that it's safe. We know that it works. People do have a concern that they can still get an infection after getting the vaccine. But I want you to remember the main goal of the vaccine is to prevent serious illness, hospitalization, and death. And it has consistently been effective. And it is the best thing that we have right now to prevent those types of serious complications from COVID infection. And so the more people that are vaccinated, the better your entire household, community, neighborhood, school. It's the best thing that you can do to protect you and everyone around you. And not only that, if you're vaccinated and you're less likely to get sick, you're not missing days from school for your children. You're not missing days from work. We heard Dr. Shapiro say that, it's still a 10-day isolation for the children who get COVID-19. So that's 10 days missed from school. So you want to have as little disruption as possible. It works and it's safe. Get vaccinated.
Thank you. Dr. Nicholas, same question.
So I had this conversation a lot with both patients in my practice as well as friends and family. And I'm going to say exactly what I say about the flu shot. For the majority of people that get COVID, you're going to have a mild illness, a couple of days of not feeling well, cold, maybe a fever, and you're going to be just fine. But really, a lot of what we're doing with the vaccine is protecting those of us around us who either can't get the vaccine or whose immune system isn't as well versed as your immune system. Perhaps they're a cancer patient who's getting chemotherapy, or they're on other medications that are what we call immunosuppressive, or means that it doesn't allow your immune system to be 100% firing appropriately and making antibodies. So the whole idea around the well people getting the vaccine is really to protect those around you who potentially can't get the vaccine, who maybe wouldn't have as good of a response if they did get the vaccine themselves, to protect them from getting the illness. As I say to my patients, I don't really care about you. I care about everybody else. It makes everybody chuckle. But really, let's think about the greater good. Let's think about protecting, that little, 6-year-old who's getting chemotherapy because she has leukemia, or the 87-year-old grandmother who can get the vaccines, but maybe doesn't have as much of an immune response. And if she gets COVID, she becomes much more sick than you would. So it's really not about you. It's really about everybody else. So I'd implore everybody to get the vaccine.
Thank you, Dr. Nicholas. And Dr. Shapiro.
Well, my colleagues have answered this question very extensively and very completely, Rich. I want to just take a slight turn and pivot on how I answer this, because realistically, we're not in the same place we were a year ago. And I want our audience to understand that. And in doing so, I'd like to give you 5 simple thoughts to take with you as you look at what the issues are pursuant to vaccination, which has made such a huge, huge change in our lives. We're just not in the same place. So the first thing is, treating COVID could get easier. We know we already have pills that can, if you use it at the proper time, make a big difference in the outcome and certainly allow you not to suffer severe consequences. We also know that that as we get more efficient in testing, testing to be able to know if you're infectious now is going to become much more relevant and available. You can already see it trickling into the pharmacies, and certainly go to the website where you can sign up and get several free tests from the federal government. Self-swabbing before socializing is going to become a real norm. And in the children's population, testing to stay in school is going to become a much more commonplace finding. There's 10 to 30% of people will go on to develop long COVID in the adult population. There are groups now beginning to study long COVID and understand what it is that constitutes this autoimmune response to this very novel virus. I think that's going to help a lot of people feel better about themselves and change the way we think about things. But I think, when we talk about variants, I don't think there's going to be any relaxation of our concern for variants. Variants are going to come in 2022, just like they came throughout 2021, 2020, and 2021. As long as less than half of the global population is not fully vaccinated, this is going to be a standard of care that we're going to have to learn to deal with. And we're going to learn, and we've learned that boosting, wearing masks, being vaccinated, steering clear of crowds is going to help us to become much more facile with the world around us and lead us to a place where the pandemic changes to an endemic condition, similar to what we go through with flu every season. And I hope we get there, because that'll give us the hope and the resolve to move forward with our lives. So that's how I'd like to answer the question in terms of what what the next steps are all about. And I hope you can understand, we as physicians and practitioners really care very much about how you feel and how we can help you. There were a lot of times when we didn't have answers, but now as we have more of these answers and you can see what's coming, we can be a great partnership with you, for you, and to help your family stay active and fully enjoying the lives that you can live around the situation at hand.
Thank you, Dr. Shapiro. So we've come to the end of the questions that were submitted ahead of time. And there are a few questions that have been typed into the Q&A that we will try to get through in the remaining time that we have. So the first question, actually, if the panel doesn't mind, I think I'm going to take this one because this is actually something that I've dealt with quite a bit. The first question is, the CDC has recommended an additional booster for immunocompromised individuals, yet pharmacies are refusing to administer them. Is the problem in the CDC's unclear messaging? What are your thoughts on this? So let me describe exactly what the recommendation is. First of all, the immunocompromised individuals are a very, very specific group. So these conditions that have been described where the immune system is compromised, it's not just people who have various illnesses and may be a little bit more susceptible to colds. These are very specific illnesses that affect the immune system response. And it can be, for example, someone who has cancer who's on chemotherapy. It can be someone who's taking a medication that affects their immune system for psoriasis. Those are the specific types of the immunocompromised individuals for whom this is recommended. The second thing to understand about this is that this is not a booster, this is a third dose. And here's the difference. The third dose is for people who have a problem mounting the immune response so that when they get the first and second doses of the vaccine, their response is not good enough. They don't have enough antibodies. Those memory B and T cells that I mentioned before have not been fully activated. Therefore, they get a third dose to get to that same level of immunity that the people who are not immunocompromised get to. So that's the difference between a third dose and a booster. A booster is for someone who achieved that level of immunity, but the antibody level has gone down over time, and this is to bring it back up. So that explains the difference between them. If pharmacies are not administering these according to the CDC guidelines, then perhaps some re-education might be necessary, but it is pretty straightforward. I can tell you for an absolute certainty that at our county sites, we are administering both these third doses and the boosters where they are appropriate. The one thing I would just mention is just keep clear in your mind what really fits that definition of immunocompromised. And remember that these are very specific diseases or people on very specific medications, not just people who might have multiple medical problems. That's an entirely separate issue. We'll move on to the next question, and this one definitely goes to Dr. Shapiro. You had stated that no booster has been recommended for age 5 to 11 children. However, PA Health Advisory 6119 stated that Pfizer is authorized and recommended for this age group. Can you reconcile this conflicting information?
I apologize. I'm not aware of any recommendation for 5 to 11 boosters just yet. Remember, though, recall, though, that the initial immunization of 5 to 11-year-olds only began maybe a month or 6 weeks ago, 2 months ago. So we really haven't even gotten to that point. There may be a recommendation that I haven't read, and I certainly acknowledge that. But at this particular time, we are not authorized, nor have we gotten to the 6-month marker, but we've not been authorized to give it. And as I said in my remarks, it may be that there would be a different role for the vaccine in the 5 to 11s. You got to remember the immune response in a 5 to 11-year-old isn't what it is in an adult. So there may be a different methodology that is described from the science that is developed. So I must just say at this point, we're not ready to make that decision.
And I might emphasize that the vaccine itself is certainly approved for that age group.
Oh, yes, absolutely. No, there's no question. We're
Yeah, it's
giving
just
the
the question whether
vaccine.
the booster is
The
recommended.
booster, yeah, I'm sorry. If I was only referring to the booster dose. By all
Right.
means, the 5 to 11 children should be vaccinated, and we give it in our office regularly. So it's a great vaccine for that age range right now. We just don't have all the information about the booster. I was only referring to the booster.
I thought that might have been the
Yeah.
question from the audience member.
Okay, I'm sorry.
I think this one should probably go to Dr. Lee. For new mothers that breastfeed and are vaccinated, does the vaccine have any effects on newborns?
The vaccine does not have any negative effect on the newborns. And in fact, if the mother is vaccinated, the antibodies in her body transfer to the baby through the breast milk and can protect the baby against getting a COVID-19 infection, because as we discussed, there is no vaccine yet approved for children under the age of 5. So a breastfeeding mother getting the vaccine is a great way for her to protect her baby by passing on the antibodies, and simply because she now has a greater protection against infection because she is vaccinated. But there has not been any study showing any negative effect on the baby's growth or development, and it is recommended.
Thank you. Dr. Nicholas, this one's for you. If my children and myself have the 2 vaccines but can't get the booster yet because of the 6-month wait, actually it's a 5-month wait now, then get COVID-19, how long after COVID-free can children or adults get the booster?
Well, so they should be able to get the booster soon after they're feeling better. After your quarantine or isolation period has ended, you should be and feel free to go and get the vaccine at your local pharmacy. There used to be a lot of requirements or some rules around, how long you should wait, wait because you have antibodies. And we really said that because we were trying to hold off to try to have as many people have antibodies as possible. But now that the vaccine is really available and we have lots of vaccine available in the community, don't let that stop you from getting the vaccine or from getting boosted. Just go ahead and get it at your normal time that you would have, assuming that you're finished with your quarantine period.
Thank you, Dr. Nicholas. Let's see. So there's a question here talking about the comments that we've made in terms of pregnancy and fertility, that there's a lot of disinformation about, and there's a lot of confusion, apparently. There's a mention, of course, that there is a lot of political aspect to this as well. So the public seems to have developed some degree of fear and lack of trust because the message seems to keep changing. So the question is, why aren't the various physician organizations, the AMA and others, standing together to ensure that correct information gets out? I think I'll jump in again on this one and just point out that this program tonight, the town halls that were held all through 2021, the ones that we're planning to do through the rest of this year, are examples of how we are trying to get that information out. And we recognize that sometimes the messaging has been very, very confusing. Sometimes it's been because it's come through a political filter. Sometimes it's because, as we talked about before, the science is constantly evolving. So there are times where we have to answer a question first by saying we don't know, and then 2 weeks later, maybe we do know, maybe that data comes out. But I can tell you that I have seen all the organizations, the AMA certainly has, the local medical societies, the specialty associations, the American Academy of Pediatrics, the American College of Physicians, the American Association of Family Practice, certainly CDC. All of these organizations have made an outreach effort to try to get this information out to people. What I find generally is that there's so much information and it is so confusing that it becomes very, very difficult, not only for a layperson to understand, sometimes for a practitioner to understand as well. So keep in mind that the information is constantly changing, and we're doing our best to keep up with it, and we're doing our best to translate it into something that's usable for the general public. And again, I would point to the fact that these town halls, we feel, are a great opportunity for us to go directly to the public and give the information that will help you. I really, really do appreciate that question. We have another question on breastfeeding, which I think has been addressed. And I'll read this question and then I'll just leave it open to whoever would like to take it. Is re-entry to a church whose mean age congregants is age 67, but are vaccinated and boosted, safe? Or are virtual church services still the safest approach for this group? And I'll open that up to the panel.
I don't mind answering. So first of all, I would like to say each individual has to make a decision for themselves. Everybody's health situation is different, and your risk is different, and your vaccination status is different. Right now, though, we are having a COVID surge. So being in a group right now probably is not the best idea, because we know that Omicron is very, very, very contagious. And so when we're talking about individuals over the age of 65, who in general likely have a higher risk for complications of COVID, you might consider a virtual church. But each person has the freedom to make their own decision based on their situation. And again, I would say their church size. Churches too come in different sizes. Some churches are very small with maybe only 10 congregants, and then other churches literally have thousands of congregants. So these are all the things that you have to take into consideration when you make that decision.
Then can I add something to that, Rich? I think that the church and synagogue communities have pivoted magnificently in offering either style of prayer to their communities, whether it be virtual or in person. I'd only like to emphasize one other point to you, ladies and gentlemen, that during this 2 years, 2.5, almost 3 years of pandemic time, we've learned certain things. We know masks work, social distancing works, keeping our masks on and avoiding periods of time with exposure to food is going to help us. I mean, we work on that all the time for children in the lunchrooms in their schools. Kids are incredibly good about keeping their masks on, sitting separately at a social distance, taking their mask off, eating beautifully, putting their mask back on, and then going out to play. And I think those same rules can really apply to the church and the synagogue. I think prayer is a strong motivator for people to return to normal, to some level of normals. I think we need to be cautious. I mean, singing, unmasked singing can create a problem for us, at least at this particular time. And until we get a little further along and see this Omicron peak dissipate, I think just being ultimately as cautious in using the rules that we know exist and that have worked for us, using them and applying them could be very sufficient to allow us to regain some degree of normalcy.
Thank you. I think I'm getting a cue that we've reached the end of our question period. I did want to address the question that was there really, really briefly. Someone was asking, where do you get the free tests and the masks that the government will be supplying? I'll just tell you very quickly, for the tests, you can go to COVID tests, all one word, .gov, and order 4 per address. For the masks, they are being distributed through the federal pharmacy program. I believe CVS, at least, is a member of that program and will be offering them. There'll be more information on that to come. You should also be able to find that information on the Montgomery County COVID-19 website as well. So having said that, we've come to the end of our program tonight. And thank you, Kelly, for putting that into the chat there. I will just have some very brief final thoughts from each of our panelists. And I'll start with Dr. Lee.
So once again, thank you for having me. I hope this information was helpful to you. And all I can say is go get your vaccine, wear your mask, and be careful.
Thank you, Dr. Lee. Dr. Nicholas.
Probably one of the things that I've been reflecting on a lot over the past, year or so has been, how masks have become part of what we do every day. But I also want to recognize the fact that we're all tired. We're tired of not seeing our friends. We're tired of not being in groups. We're tired of not going to concerts and football games and all of the things that make up what we do as Americans and feel that it is all right. But I just caution you to think, be smart about what you do. Go to places where you know that you're going to be protected. If you do get sick, please take a test. Please make sure that you don't go into work or don't go to the daycare center to pick up your child, or go to a place where there's a large number of people there, because you could potentially become that person that gives COVID to everybody else. And again, a lot of people think they just have a sinus infection and they in fact have COVID. So I know we're tired. I know this is hard. I recognize that everyone's mental health is getting affected. So if you do feel like you're really struggling with your mental health through all of this, please reach out to your primary care providers. We do have some resources available for you, and we do want to help.
Thank you, Dr. Nicholas. And Dr. Shapiro.
Well, thank you very much for letting me join this panel, Rich, and to Kelly and to Beth and the Montgomery County Immunization Coalition. My take home for tonight is get the facts from places that are reliable, complete, and consistent with the truths surrounding this pandemic. Don't be dissuaded by people who are speaking off the cuff, but try to get to the sources of information. Those sources certainly can be the county, the Immunization Coalition, your providers, your primary care doctors, and those people who will get you the information that you absolutely need to have for the situation that you're in. Thank you.
Thank you, Dr. Shapiro, and a special thanks to all three of our panelists for the excellent information that you have shared with us tonight. Final thanks also to the Montgomery County Immunization Coalition and Beth Till, who has done an incredible job throughout this entire pandemic, getting information out to the public. And of course, as always, our technical expert from the county, Kelly Cofrancisco. A final thank you to all of you in our audience, both in terms of logging on to the meeting tonight, those of you who are viewing it as it's streaming on Facebook and other social media platforms. The recording will be available for those of you who would like to review it, or if you'd like to tell your friends about it. So please feel free to log on and view it at your leisure and share the information. We will have further programs going on in the rest of the year, and we will make those available to the public as they are planned. So once again, thank you all for joining us tonight. I hope we've been helpful, and I hope we can continue to answer your questions. Good luck and good health to everyone.